name is Laura Blakemore, and I am the CEO and an orthopedic surgeon at Pediatric Specialists of Virginia.
My name is Ian Leibowitz. I'm one of the originators at PSV, and I'm the chief of gastroenterology here. I work as a gastroenterologist, and I also for many years served as the chief medical officer for PSV.
My name is Ann Claggett, and I'm the clinic manager for our off-site location.
My name is Luz Peña, and I'm a patient representative and interpreter as needed.
I am Robin Dolman. I am a pediatric hematologist oncologist, and I have been with PSV since its conception nearly 10 years ago.
I am Jenny Rakenna, and my PSV role is lead for the 6th floor PSR.
So I'm Bill Judd. I'm the Chief Operating Officer here at PSV.
So PSV was formed with a vision of creating something sort of special that really didn't exist in our community before, which was a unified effort to provide great specialty care. I think that vision was unique, but I also think that one of the things that I've found working here that's been really unique is that there's a sense of camaraderie, a sense of adaptability, of family, of teamwork that goes into PSV that you don't often see at institutional types of organizations.
The thing that makes PSV special is our people. I've worked in healthcare for almost 35 years, and I would say PSV has the most compassionate group of healthcare professionals that I've ever worked with.
The feeling of having that family feeling, all of us getting together, working along together, having that family feeling.
We have been able to work with each other, form a bigger group. We've gone through our ups and downs as well, but we've been able to maintain our connection to the community as well.
Well, I think they're unique and special because they've definitely supported me through my time with PSV and given me lots of opportunities to be able to learn and progress myself with the things that I can do for this company. So they've really given a lot of support to me over the years, and I think that's kind of unique. There's not a lot of companies out there that do that on the regular for their employees.
It's always a great pleasure to come and work here. We're all like family.
It's really an honor to see how people give 110% every day to the children and families of Northern Virginia. PSV has evolved quite a bit over the last 10 years.
Well, I think it's evolved greatly in terms of how it's even just grown.
Gosh, it grew tremendously.
PSV began as a combination of efforts from Innova and Children's, where a group of physicians from both centers were placed into PSV to form it.
A partnership between two different healthcare systems, which is unique, and there aren't very many like that in the country, but it's a great model.
We started out as 4 or 5 specialties, and
our mission was to grow and expand our services over the years. So at one point we grew to have 21 different specialty services. We've since obviously did some transition and evolved into PSV 2.0, where we now have our 6 core specialty services, as well as we still have our ambulatory surgery center.
It's been a lot of changes, but I think we're heading in the right direction.
I've never worked at a place where people were so good at responding quickly to sort of the environment. I think it's because of the size of the organization. It's not a big healthcare system, but it's connected to these 2 big healthcare systems. So it's really able to be laser focused on ambulatory care, which is outpatient care, while providing the kind of inpatient care, trauma coverage, all coverage, consults for the hospitals that we need here in Northern Virginia, as well as at Children's.
It's got its footholds in both DC a little bit, but really is a pillar within the community here in Northern Virginia. It's a one-stop shopping for many of your pediatric subspecialty needs with locations around Northern Virginia. The provide services to all of our patients.
One word that comes to mind when I think of PSV is care. It's our value, and it's everything we do.
Community.
The diversity. I think everyone is welcome and appreciated.
Teamwork, definitely. Whether it be wearing your position, front desk, whether it be with your management, HR, admin, everywhere, other floors needing help, we all just come along together.
One word that I think of with PSV is opportunity. I'm somebody who worked for this company for a long time as a medical assistant, and I was given the opportunity to become a manager in this company based on my experience, not necessarily my education. And I think that is pretty cool.
I think partnership, because it's all the things in our mission about we care. Care is about compassionate care. It's about excellence. We do all that. We do it through this partnership, which is really something that, again, that you can't find many places. And for two big systems like that to sort of get, to collaboratively run a pediatric specialty group like that is really unusual.
So I think when PSV was formed, the word I would have said is that this is an opportunity. It was an opportunity to really provide the community of Columbia, Maryland, and Washington with the best that both parent organizations had to offer, an opportunity to create something unique, truly focused on excellent clinical care, but utilizing the resources of both parent institutions to provide something that really up to that point didn't exist in our region, specifically in Northern Virginia, but I think it would have allowed the entire region to have the kind of elite level care that both institutions would like to provide to patients, but hasn't really existed in our tri-state area to this point. If I used one word now, it would probably be adaptability. I think we've been extremely adaptable, that we've gone through different transitions of staffing, both medical staff and administrative staff, and through all of that have generally maintained a pretty happy, good working environment with great staff. We've been really adaptable to these kinds of changes.
I'd like to say happy 10th anniversary to PSV. One team.